you tell me a little bit about the program, your mobile and connected health program at the University of Southern California? Tell us what it's all about.
I would love to. It's a new program, so I'm making it up as I go. I was hired away from the medical school at the University of Southern California to a new transdisciplinary center. Within that center is a Center for Economic and Social Research, and they hired me to build this program of mobile and connected health across the university. So it's extremely exciting. I still hold an appointment in the medical school, so my main appointment is now building this center.
And how long, when did you start doing this?
End of August, so it's all brand new. Yeah.
So what is the mission?
So we're developing the mission, but what I can tell you what my mission is.
Yes.
As a mobile health researcher, I found the idea of working across the aisles, of doing the transdisciplinary work, of finding good collaborators, of knowing when to switch from an academic engineer. I'm a behaviorist. Sometimes you work with academic engineers that need to write papers that are really creative, that help you rethink how you're going to do your sensing, what you can sense, and how you can use your data. And then sometimes there's maintenance phases where you really need just programmers who are good at their work, who can do some maintenance or do some tweaks for you. And you need to know how to transition in phases of who you need to have on your team, who you need to have on the back burner, how that can work for everybody in academia, but also to make the best research to get it out to the public. So that when you go through the whole cycle, we have something that we can maybe hand off as something that might be a commercial project. So how do we go from A to Z, and how do we do that together to really utilize mobile health to change the way that we look at behavior, and to change the way that we change behavior, and to help people change their behavior for good?
So you may not be at this point yet because this is so new. August is not even a year.
Yesterday, kind of.
It's yesterday, kind of. I'm just wondering if you have some projects in mind. I mean, I understand that you're creating the mission right now, and
I do. I have several.
You do?
Oh, yes.
Could you mention a couple?
I sure could. So let me see, maybe 4 of them. One of them would be using real-time technology to intervene in real time, so just-in-time interventions. We've done one of those, and at a very small scale, so now it's time to build that out, to use it not only for obesity, but to get people involved in really utilizing and capitalizing upon real-time technologies to give. So if I know what you're doing, I can give you feedback in real time to say, hey, you've been sedentary for 2 hours, why don't you see if you could, why not? I mean, we have the capabilities to do this. So that's one project that I really want to get off the ground and spread that. Just not obesity is my world. I'm an obesity researcher. That's where I come from, the world of researching and trying to change obesity-related behaviors like diet and exercise. But this could be used in smoking, in mental health, in drug use, in
all sorts of bad habits.
All sorts of bad habits, but also for a healthy aging in place. Across the board, just-in-time interventions are, I think, where we need to go. So that's one. Another one is using all of these technologies, all the data that we gather, that you gather, even if you don't I wear all sorts of gadgets. I've got a gadget here and a gadget here and a gadget under my clothes, which I won't show you. But even if you don't use those, just by the virtue of the fact that you use a computer and the interweb and your mobile phone, which is probably a smartphone, you're gathering data on yourself all day long. We reveal ourselves and each other through this incredibly vast digital footprint that we trail through life. And it's this wonderful, temporally dense, continuous data. And if we could just build systems that would make people want to give us their data all the time, I think we can do that. I think we're very close. We need to think about interactions that are brief, like micro interactions to get, so I need to ask you questions sometimes. Sometimes I can just get your physical activity with a monitor, but sometimes I might need to know something that I need to ask you, like how do you feel? So there's ubiquitous measurement, there's self-report. I think we'll never do away completely with self-report because there's no measure for tummy ache. I have to ask you. So putting those kind of measurements together in quick micro interactions, I think moving towards heads-up devices, all of that, but using that rich data to redevelop models of human behavior, real-time models of human behavior that are testable, computational, that take into account the loopiness and the changes in human behavior that are affected. If I didn't have a good breakfast this morning, I would be tired now, and this interview would be completely different. So, accounting for all of that, that's another I think that's an incredibly important, huge project that we need to understand.
I'm amazed that you have, and I know you have two more that you wanted to talk about, but I'm amazed that you have so many started or at least in mind on paper.
It's what I do. I live and breathe
It's what you do.
Yeah.
But also, as I mentioned to you earlier, I noticed that you have a master's in fine art, but more than one, perhaps.
3.
Tell me about that and how that might tie into your work at the University of Southern California. Or maybe it doesn't.
I'm not sure it ties in directly into the work. I have 2 master's degrees in flute, one in performance and one in teaching. I'm an accidental scientist. Mm-hmm. I stumbled upon the University of Amsterdam one night after a concert, and they had a new evening program. I'm serious. Uh-huh. And I just went in to sort of check it out because I'd always been interested in psychology, and ended up getting into the program, slowly changing careers. So I really kind of am, I come to it a little bit differently. I'm a little bit more, I'm not so risk averse. I want to know what's new and exciting. I really see the possibilities. Oh, my other master's in fine arts is in creative writing. So
I heard poetry.
That's right.
Yeah.
So keeping people creative also in science.
And the idea of not being risk averse
is
how you discover.
Yeah.
Right?
Yeah.
So that's great. And finally, I was just wondering if what you might have seen here. You've been here a day or so?
I've been here, actually, we had an mHealth training, so I've been here since Saturday.
Oh, so anything that kind of excited you here at the summit this year, or anything that kind of piqued your interest?
Oh, there's so many great things, yeah. I think, actually, the thing that I can't get out of my mind, so I might as well just say it, the things that have piqued my interest the most might not be immediately obvious here, but things that I know are coming up because I see all of my friends and colleagues here.
Oh, yes.
So, what's coming down the line with wearable sensors that can sense diet, that can sense dietary intake, which is really the hard question in mobile health or in any, it's been the hard question for years, how to measure diet.
Yes.
It's almost impossible. So there's, some wearable sensors, some patches coming down the line for that. So anything that measures diet, I find very exciting.
Which fits right in with your work, actually.
Fits right in with my work. I'd say that's more like talking to people here, which makes it such a great place to come. And I think some of the other stuff that I've seen around the booths here are moving towards the technologies that I want. What I would like is easily placeable sensors for in the home that do a lot of things, like recognize your phone or recognize your motion because of your height. Maybe you can use a Kinect or something for that, but something that can follow you around the house. So new sensing sets, and I feel this year that we're getting closer and closer to some of the sensors that I would like to see developed.
Right. I was at a breakfast this morning where it was a panel discussion. They were discussing sensors, one piece of the discussion, and there was someone there who asked about the electronic health record, because of course all this data, all this information could be, may not be, but it could be sort of dumped, for lack of a better word.
De-identified and made publicly available.
Or no, it was also how can the care providers really handle that much data and still have it be meaningful? And so they were struggling with those questions this morning.
So here's something that's really exciting to me here, and that is that IDEO and other user-centered design people are here now and becoming more and more integral part of this. Because those are the people that you need. So when we go into the field with our technologies, like for instance, this one study I did that was using real-time technologies to change physical activity behavior in kids. And when we developed the dashboard for the app on their phone, we developed it with them because we knew that we had to have a dashboard that gave them the information that they want. When their parents were in the focus groups, they wanted a totally different dashboard. They wanted to see different parts of that and different menus. So working with clinicians to know what they need and what they don't want and how to make it accessible to change, and how there's some really great research coming out of UCLA on that, on making these dashboards that are good, that clinicians really like, but it's really a user-centered design problem.
So there's a way to solve that. Yeah.
Yes.
All right. Well, thank you very much. It's
My
been a
pleasure.
Thank you.